Hi, everyone. Really nice to be back after a little hiatus over the summer. It's nice to be back. I understand we have kind of a smaller group today, which is totally fine. Hopefully that will allow us to have opportunity for, a little bit more questions and answers at the end. I'll try to answer questions as best as I can at the end. So today we're going to be talking about creaky hips or hip pain. And I'm glad Nadia suggested this as a topic because this is one area where we find a lot of times people come to us because they say, I have an issue with my hip. And a lot of times pain in the hip is actually not the hip itself. So I hope that in the lecture today, I can kind of clarify some different structures that give pain in the area of the hip, but may not necessarily be the hip. So we'll talk about kind of the different diagnoses, how they're different, where the pain is, and then we'll have some time at the end. Some of the exercises are going to be lying down, so I'll probably just demonstrate those. And then we'll have a couple of standing up exercises as well that people can certainly do with me as we do those. So I'm going to try to share my screen here. Okay, hopefully everyone can see that screen. Let me just start my slideshow here. Let me just see if I can get it to do a slideshow. Here we go. Okay. All right. Are people seeing the whole screen or are people just seeing the single slide?
Just the slide. I think you need to make
slide.
Excellent. Okay.
Yeah. Well, I think you need to start the slideshow.
Yeah,
Yes. And over in the left there.
Okay. Is it?
Yep.
Okay. Here we go. Now we're in business.
Perfect.
All right. So this is going to be our talk about hip pain. And like I said, hip pain can have many different causes. And oftentimes the cause may not actually be the hip. So we're going to talk about kind of the four more common ones today. We're going to talk about osteoarthritis. We're going to talk a little bit about bursitis. We'll talk about sciatica, and we'll talk about sacroiliac inflammation. Again, these are all things that are commonly mistaken as actual hip pain. So the first one is our osteoarthritis. So this is actual pain in the hip joint. And let me see. I'll stop my slide share in a minute here so I can show people kind of where this hurts. But this is where the joint surface in the front of the hip joint or in the actual hip joint wears down, and you can end up with bone spurs, uneven surfaces, and you have pain right in the hip joint. So let me stop my share a second. So this, if somebody comes in to see me and the pain is right in the front, kind of right where I'm pointing, then we know, yes, that is pain in the actual hip joint. As we talk about some of the other ones while I'm not on the share screen, if pain is more on the side, so if somebody comes in and says, my pain is right here, then that's more likely bursitis. If people are like, oh, my pain is in the back, and they're coming in for hip pain, but they're pointing to areas back here, that's more likely sacroiliac inflammation or sciatica. So that first slide that I just showed everyone, that I'll try to go back to here, that's actual osteoarthritis in the hip. Next one. All right, so some of the text on these slides, I just took straight off the internet. from either the Mayo Clinic or Cleveland Clinic. There's nothing particularly fancy about the text, but again, osteoarthritis is the most common form of arthritis. It affects millions of us. And this is where the cartilage that protects the bone, the ends of the bone, wears down. It can damage any joint, but hips are one of the more common ones where we see it. Once you have the arthritis, nothing that we can do will make that arthritis go away. You can minimize some of the symptoms of it, but we can't reverse arthritis once it's there. But certainly things like staying active, maintaining a healthy weight, keeping your strength up can slow the progression of that osteoarthritis. Oops, sorry, I'm having a little trouble with the slides today. I want to jump to one second to try to back up here. Here we go. All right, so some treatments that may be recommended can be medication, so typically anti-inflammatory type medication. And as far as questions regarding medications, those really, you have to take those up with your physician. Exercise, that's where I come in. Land-based or water-based. We really like water-based exercise for osteoarthritis because it allows you to strengthen, move those hip joints without having the actual loading of your body's weight on them. Things like hot pack or cold packs can certainly relieve symptoms intermittently. Physical therapy, occupational therapy, other types of exercise. When we see people in physical therapy, we will certainly do flexibility and strengthening exercises. We can also do what we call manual therapy, where we mobilize the joints to just give that joint a little bit more motion. And it's a good technique that we use for reducing pain. Definitely, if you have been diagnosed with arthritis, if you are carrying a little extra weight on your frame and are able to take some of that off, it does help. Not always the easiest thing to do because sometimes it hurts to exercise, but that's where things like the water exercise can come in really handy. There is some research that managing diabetes and cholesterol can decrease some of the symptoms associated with osteoarthritis. And then we may be looking at things like braces, shoe inserts, even just the type of shoes that you're wearing can make a big difference in terms of how happy or unhappy an arthritic joint is. So that's something, if you're like, I'd really like a therapist to look at my footwear, we can certainly do that, even if you're not interested in per se going through all the exercises. So things like proper footwear can help. And sometimes we really would recommend something to take a little pressure off that hip joint through the use of a cane or a walker. The intra-articular injections are becoming more popular. Some physicians will do a steroid injection into a joint. Some of the hyaluronic acid injections are newer. They're typically not covered through insurance. The research on those is a little bit mixed. I've had patients who just had great benefit from those and others not so much. And along those lines, there are kind of other alternative medicine strategies out there that, again, sometimes people find those are helpful, just that the research is a little bit mixed. And like I mentioned earlier, once that arthritis is there, nothing that we could do, especially as therapists, would make that arthritis go away. So if it's bad enough where it's really limiting your function, then joint replacement surgery is often what's recommended for a severely arthritic hip. I've been a therapist for over 30 years. These surgeries have gotten so much better than they used to be. In the last 5-10 years, just the advances that they've made in joint replacement surgery has been huge. where the recovery time is much quicker, the surgery is much less invasive. So, I really would encourage people to consider that option if they've tried other options and they know that those joint surfaces are really worn. You can see in this slide that a total joint or total hip replacement has two parts. So it has the part that goes into the femur, which is the thigh bone. That's the ball part, and that actually gets inserted into the bone. It's coated with like a porous coated material, which allows the bone to actually grow into that metal, which is a lot better than when they used to just use kind of a cement material. Now the bone actually grows into it, so it's really nice and solid. And then they, for a total hip replacement, they'll put this cup part in the pelvic bone, and then the two pieces together then work as your hip joint. Sometimes people may have just a really bad lower part arthritis where they don't need that cup to be replaced, and that would be considered a partial joint replacement. So depending on your situation, your surgeon, they may opt for a partial or a total joint replacement. And again, the recovery is much quicker than what it used to be. Nowadays, total hip replacements, I've even heard of some people having those on an outpatient basis, but usually it's 1 or 2 nights in the hospital, followed by probably a couple weeks of therapy in the home, and then a couple weeks or months of outpatient therapy after that. But most people, after about 4 to 6 weeks, are really starting to feel pretty good after this type of surgery. So if anyone has questions about that at the end, I can certainly elaborate a little bit more on that. All right, so that kind of covered that first diagnosis. That was the osteoarthritis. Now we're probably talking about the second most common reason why we get people to come to see us in physical therapy. And this is, like I pointed out earlier, when people say they point right to the side of their hip, and they're like, I have so much pain on the side. That's usually not the hip joint. You see these little blue sections here? Those are bursa. And bursa, what those are little fluid-filled sacs that protect the joint from where the muscles slide over the bones or the tendons. And sometimes those become inflamed. And when you have an inflamed bursa, that's bursitis. And so this is just a little text slide that again talks about what a bursa is. When it becomes inflamed, it's bursitis. So what are some of the things that cause bursitis? Usually bursitis, one of the most common things that we see are people that are sleeping on their sides, that are not people with a lot of extra padding on their frame. So if you're a little bit on the thinner side and you like to be a side sleeper and your mattress is pretty firm, that pressure of your body on that bursa repeatedly, if you're always like, oh, I always sleep on my right side, that is one of the most common things that we see as a cause for bursitis. So therefore, one of the treatment recommendations that we typically go to as our first kind of line of defense is to try to not sleep on that side, or to look at either a mattress overlay, something that takes that pressure off of that bursa. Over-the-counter pain relievers, especially the anti-inflammatory ones like ibuprofen, naproxen, are also usually what the physicians will recommend, because this is an inflammation. Anything that reduces that inflammation can be helpful. So alleviating some of that pressure, taking anti-inflammatories, using ice for bursitis, is another common intervention. We don't often jump to using canes or crutches for bursitis. It is in this slide, but that's probably not the first thing that we would go to. Certainly strengthening the muscles around the area is where we can help. Certain stretches. I have had patients that have come to me. I've seen them for 4 weeks, 6 weeks. They did everything right. They changed their sleeping position. They were using ice. They're doing the exercises. Pain still persists. They see the doctor. They get one injection right into that bursa. Pain magically gone. So, the surgeons usually will want people to try something a little bit more conservative first. But again, steroid injections can be hugely beneficial if you've had something that's been lingering and lasting. Other than an injection, you really would never, removing a bursa. That's really not something that we're commonly seeing, that they're going to that. All right, so that's bursitis. And bursitis, you would notice that, like, if you're putting pressure on it, if you're lying on that side, but also climbing stairs, a lot of times just the way that the muscles kind of hit the side of the hip when you're climbing stairs, typically people are like, oh yeah, every time I step up, I feel that pain on the side, not in the front, on the side. So that's another diagnostic criteria that we would use, like, yeah, it's probably bursitis. Okay. So now, let's see here. The third one that I wanted to talk about is sciatica. So this is looking at somebody from the back, and these are the nerves that we're looking at. So as the nerves come out from your low back, if there's pressure anywhere along, whether it's up in the spine or as that nerve travels down, if there's pressure on that nerve, you're going to feel pain in that buttock area. So pain that sits in the back, in the buttock, if somebody comes in with that and says, oh, my hip's been hurting, I'm having trouble with my hip, usually we're thinking, probably not the hip, probably something putting pressure on that sciatic nerve. And then we as therapists can certainly kind of put you through different test positions. If we can make you bend one way versus another, and we either decrease or increase the pain, that's a good way that we can tell, like, yes, this is pressure on the nerve. It has nothing to do with the actual hip joint or the bones itself. So again, it's sciatic pain refers to pain that travels along the path of the nerve. It can be coming either from the back or as that nerve travels along the hip or into the buttock. So herniated discs would be something in the spine itself where it's putting pressure on that nerve, but also as that nerve travels through the buttock area, it goes in between two sections of a muscle called the piriformis. And sometimes if that muscle is tight, it can be putting pressure on that nerve right in that spot. And that responds really well to therapy because we know the right stretches to do, get that muscle loosened up, take the pressure off that nerve. And sciatic nerve, oftentimes pain will travel even further down into the leg as well. So that, again, a little bit different than pain in the front or in the side and not related to the actual hip itself. Some other treatment options that physicians may use, things like muscle relaxers or painkillers. We obviously would like to see therapy be something that's used before. They do use spinal injections where they'll go in and actually inject that nerve with a numbing agent right right along the spine, and people can have significant relief, kind of quick relief. And then other things like chiropractor, acupuncture, massage, those can also be effective in taking some of that pressure off of the nerve. Right, and then this last one, definitely another one where people talk about pain in the back or kind of deep in their buttock, where they think it's the hip, but actually it's not the actual hip. So the sacroiliac joint is where the pelvis meets the tailbone. You can see that on this slide. The sacrum is our tailbone. The ilium is the big wide part of our pelvis. Where those two come together is the sacroiliac joint. And if that area gets inflamed, then you can kind of have that deep buttock pain. Typically only on one side. It would be rare that you would have that on both sides, like it shows in this slide. So things with sacroiliac pain, usually those symptoms occur more when you're not moving. So if you're sitting or you're sleeping, lying, if you're still and you notice, oh, I'm just having so much discomfort in that low back, buttock area, we're usually thinking, okay, that's probably sacroiliac. But things like going up and taking a walk may feel pretty good. Anything, the sacroiliac joint does not like to be asymmetrical. So anything where there's a lot more weight on one leg than the other can trigger inflammation. I've even had patients who just from kind of stepping off the bus or off a curb land kind of hard on one leg. That jarring that then travels up that leg into the sacroiliac joint can irritate that joint. Running, not so much maybe as some of the other things. Stair climbing, again, especially if you were climbing stairs one step at a time, always loading just that one side as opposed to that other side, it would be a cause for the sacroiliac joint to get inflamed. And what are some things that we can do about that? I like that on this particular slide, they put physical therapy as the #1 thing. Definitely PT to stretch and strengthen the right muscles around that joint to get everything back in alignment. It doesn't take a whole lot of visits for us to effectively get that joint back in alignment, getting people feeling a lot better. Things like water therapy, stationary bike really just helps get everything back into the position where it likes to be. But sometimes the physicians may prescribe non-steroidal anti-inflammatories like ibuprofen, naproxen. That's, of course, is not a long-term thing. Muscle relaxers, maybe initially, but not something for long-term. And we do have some doctors here at GW who, if somebody has more of a chronic sacroiliac inflammation, they will actually go in and inject that joint with a corticosteroid. And that's, that I think that can definitely give people relief. Hopefully they're combining that then with a trip to see us so that we can make sure that things are lined up in a way that the problem doesn't recur. Okay, so let me stop my screen share here a second. So just to kind of recap, pain in the front of the hip, so pain here, that's osteoarthritis, most likely. Pain on the side, bursitis. And with bursitis, we can put our thumb right on it and say, is that it? And then people are like, oh, that's it. We know it's bursitis. More superficial buttock pain, most likely sciatica, especially if it goes all the way down the legs. deeper pain in the back, most likely sacroiliac joint inflammation. Sacroiliac joint inflammation, usually more painful with resting positions like sitting, lying down. Sciatica, more pain with movement. So those are just some diagnostic criteria that we use to determine, okay, what's what. So let me go back to my slides. We're going to talk a little bit about some stretches and some exercises. And actually, I'll probably leave the screen share off so that I can just show you these. I think that would be more effective. Let me just see these. And so these are just, I always like to give a couple of things so that people have something that they can look at. But really, if you have something that's, been bothering you for a while, getting an individualized exercise program would be better. So let me move my computer. So I'm going to show people a couple of good stretches for the hip. And these you would do on your bed. Do not feel like you have to get down on the floor to do stretches for the hips. I'm going to show people 3 different stretches. The first one would be just pulling that knee in towards your chest. That bends that hip forward, pulling the knee into your chest. A good stretch, you would want to hold that for 30 seconds. And then you would do the other side, or if it's just one side that's bothering you, you can certainly just focus on that side. So that's stretch number 1. Again, making sure you're holding it long enough, you're not bouncing it, you're not rocking it back and forth, just a nice static stretch. And especially with arthritis, sometimes as you're moving that joint through that range, you may hit parts where that joint surface is so uneven that it gets uncomfortable. You would only want to go so far where it's a tolerable, just as kind of a stretch. If you're trying to move that joint and you're feeling like someone is sticking a knife into your hip, please don't do that. Like that would only make things worse. You're trying to move these bones against each other that just have no business going into that range. So it should just feel like a nice stretch, maybe just a little tightness, but not sharp pain for stretches. So we did the first one, that was this one. Then another nice one is crossing the leg and just gently pressing that knee down. That's rotating the hip. And again, we would want to hold that for 30 seconds. I'm not going to hold it the full 30 right now, but just so that you have an idea, and you would have pictures of these in the presentation. I'll make sure to share it so that as the recording, that it has the actual pictures in the recording. So that's our second stretch. And then the third stretch, let me lower my table a little bit so you can see. The third stretch would be having one leg up, one leg down. You would want to do this kind of on the edge of your bed. You're bringing one knee in towards your chest. Your other leg is hanging down off the side of the bed. And that's stretching the front of the hip. So the area that the leg that's affected would be hanging down off the side of the bed. The other leg is pulled up. And again, 30 seconds for that. So that's allows you to stretch in 3 directions. And let me see if I can show you the pictures of these. Yeah, So there you can see that first one, pulling the knee to the chest. Second one, crossing the leg with gentle pressure on the knee downward. And then this guy, he's really stretching his because he has a strap around his foot that he's pulling that leg back. You don't need to do that to get a full good stretch on the front of the hip there. So those are just some nice kind of basic hip strength or stretching exercises. And then let me show you a couple of strengthening exercises as well. And I know some of you guys present today have seen me in the clinic, so I know you know some of these exercises because I've given them to you. So we have a bridge. That's a good exercise. I'm just trying to make myself a little bit more visible. Again, you would do these on your bed. You're just lifting your hips up. 1, 2, 3, 4, 5, and back down. Great way to strengthen those hip extensors, those buttock muscles. That's all that is for the bridge. So that's one of them. Then if we wanted to strengthen the muscles on the side, lying on your side, making sure you're really on your side, that your hips are stacked. One hip is right on top of the other. You can lift the leg up and back down. Doesn't have to be super high. Don't feel like, oh, I gotta get my leg all the way up there. No, just a little lift and back down. You should feel the muscle at the top of the hip working there when you're doing that. And that muscle on the side is the main shock absorber for the hip joint. So if you have osteoarthritis in that hip, we would want to strengthen that as much as possible so that it can help absorb some of those shocks. And then one more strengthening exercise. This is the clamshell. People that have had therapy probably know this exercise, where we can use a resistance band and we're just lifting and lowering while we're keeping the feet together. Even doing that without a band is a nice way to get that hip to rotate. Great way to strengthen some of the smaller muscles in the buttock that help support that hip joint. So let me see if I can show people pictures of that one. Okay, let's see. So we did the bridge. We did this one on the right, that hip abduction. We'll do these together in a second here, the standing hip abduction. We did the clams on the side. You can certainly do the clams on your back as well. That's a different way. It's a little bit easier to do it on your back than on your side. And then we'll do the extension. And the bands are nice. They add a little bit of resistance. The bands are not an absolute necessity for these. You'll still get benefit from the exercise even if you don't have the bands. So let's do the last two together. And these will look familiar to people that have been in my classes before, because they're some of the same exercises that we do for balance. So let's do that one where we swing our leg out to the side. 2, 3, 4, 5, 6, 7, 8, 9, 10, and even I don't know if you can see, I'm kind of holding on here with one hand. I mean, I can do it in no hand, it's a little harder. So feel free to hold on to the table, the back of a chair. Six, 7, 8, 9, 10. You should be feeling that in these muscles on the side. Same muscle as if you were lying on your side, lifting the leg up like I just showed you. 4, 6, 7, 8, 9. Good. And same with the other leg. 2, 3, 4, 6, 8. Good. And one thing just that I'll say about that particular exercise, and again, I know a lot of you, I know people who are super active in this group, which I just think is so wonderful. And I hope everyone keeps that up, but walking alone won't strengthen these muscles beyond what they currently are at. So if you say, well, I walk all the time, I walk several miles a day, that should, make me strong. It's good and it does keep you strong. It just won't bring the muscles to the next level of strength, especially some of these hip muscles. So doing something like the ones I just showed you, whether it's on your side or standing, will just allow you to get that strength to the next level. So let's finish up with the last one. And I'm going to use the band just to show you. And I think a lot of you guys have bands at home. You can buy bands online if you don't have one. Okay. And I'm just raising the table so I have something to hold on to. I'm putting the band around my ankle and we're swinging the leg back behind us. 3, 4, 5, 6, 7, 8, 9, 10. Good. Same thing with the other leg. 2, 3, 4, 5, 6, 7. Oh. Good. And again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then let's do that with the other 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Okay, good. Sorry. Lots of background noise in the room, so hopefully that wasn't too distracting. All right, I think we have some nice time for questions, but I hope that people kind of at least got a sense like, okay, there's different things that can be causing my hips to hurt. And then especially if people were to research that, look online, I wanted to give people some guidance as to, okay, what do I even look for to help me figure out what's going on with my pain that I'm experiencing. Does anyone have any questions?
Feel free to,
I do,
see,
Fika.
Lorna's got one. There we go.
Thank you. I once had a sciatica attack many, many years ago in bed, and I could not, it was the most painful thing I've ever experienced, and I didn't know how to get relief for it. Is there anything that would work instantly?
For sciatica, well, it would depend on what was pressing on that sciatic nerve. So usually, Lorna, what we would recommend is try to see if you can bend your back in a way that relieves some of those symptoms. So if it's, bending forward, pulling your knees into your chest, if that takes some of the pressure off, or sometimes it's bending backwards or stretching to the side, trying to see which way can I move my back to take pressure off that nerve if it's being pressed in the back. Not always is it being pressed in the back. So then if it is pressure on that nerve a little bit lower down, trying some of those hip stretches. If I pull my knee into my chest, or if I try that rotation stretch, does that take some of the pressure off? And then hopefully you'd have some success with that. Again, they won't inject a sciatic nerve like right away. If you went to the doctor and you said, I woke up this morning with severe sciatic nerve pain, they're going to probably tell you, oh, okay, we'll take some anti-inflammatories. They're going to try more conservative things before they would inject it. So unfortunately, there's probably not something that would be instantaneous. But hopefully trying to find positions that take pressure off of the nerve would give you some relief.
Thank you.
Any other questions? Feel free to unmute yourself or to put them in the chat. And I do want to note, I just, we had some, I don't remember if they were for a program or donated or whatnot, but I just found some extra TheraBands of the bands in our office. So if anyone would like one, just send me an email. I'd be happy to drop one off. You can come collect it. But we do have a number of those left in the office if anyone would like a band. But I see someone else unmuted if they'd like to ask a question.
Is that me, Jane?
Yes, I think so.
Yeah, okay, thanks, Jonas. Right, it says a different name. It says my husband's name on. Anyway, I have had, this has been very helpful because I've been having some, just some low back pain, I guess. And I'm sure something either coming from the spine or the hip. And I've been doing some of the exercise, like stretching the legs before getting out of bed, which I think is helpful. And you know, the couple of the ones that you mentioned, and then a couple more that you've shown us are really helpful. So I just want to say it's very helpful, and I think the whole anatomy and all of that physiology was really helpful for me too. So it's not really a question; it's more of a statement. But thank you very much.
Well, thanks for sharing that with me and then the rest of the group. You know, and that's the whole idea behind some of these lectures, is just to add to people's knowledge base, so that as things come up, that you're then, you know, more informed customer to say, okay, you know, I've tried this. I think it's this. I'm going to talk to my physician or to my physical therapist. You know, the more knowledge we have about this type of stuff, the better.
Yeah.
Anyone else have any questions or comments? Now, again, we're a smaller group today, but it does give more space for questions and for discussion if anyone would like to share. More seconds here.
May I ask another question?
Sure, we've got
It's
plenty of time.
Lorna. I've noticed that for a lot of the pain, the first recommendation is to take an anti-inflammatory pill of some type. I've tried to avoid those because my stomach doesn't handle them well. Any thoughts about the use of the NSAIDs?
I mean, you know, you know your body best. So certainly NSAIDs would be short-term recommendations, because they do upset people's stomach if they're taking them for longer term. I don't know, you know, if one would be easier to tolerate than another for you. If you've always found that ibuprofen, like Advil, is more bothersome than Aleve, which is naproxen. You know, sometimes people tolerate that one a little bit better. The topical anti-inflammatories like Voltaren is the brand name, diclofenac is the generic name. I've had patients really get some nice relief with that. A little bit harder to use Voltaren on a hip because the hip joint is so deep that if you were to put that on your skin to get to the actual hip, you probably won't. Now, for bursitis, the pain on the side, Voltaren can be quite helpful because the bursa sits so superficial to the skin. So that might be some other way to get a little anti-inflammatory relief. And then as far as like the heat ice modalities, we recommend ice if it's a new acute problem, something that just happened, or if it's something that's flaring up, like you may have had it a while and it's not bothering you too much. But then if you did something like, oh, I went to this museum and I was on my feet for 3 hours, now my hip is really bothering me, then we would recommend to use ice. If it's something more chronic that just is kind of always there in the background, then heat's probably going to give you a little bit more relief from kind of a chronic inflammation. And I've had lots of patients over the years who have pretty significant osteoarthritis who just say, if it wasn't for my heating pad, I just wouldn't be able to make it through my days. So heat can be a nice analgesic for more of those chronic conditions.
Thank you.
That's a great question. Anyone else have any last thoughts before we wrap up here? Well, thank you very much for everyone for coming out today.
And certainly everybody has my contact information. So
well, yep, definitely. And if anyone else needs it, just let me know. But thank you very much to Dr. Janson for another excellent program. If anyone has any last comments, feel free to unmute. But if not, I'll pause the recording here. And thank you to everyone for joining us today.